Hi, my name is Hannah Sonenberg, and I am in the Diagnostic Sonography program at Nebraska Methodist, and today we're doing my final capstone project on the opioid crisis. So what is the opioid crisis? An opioid is a class of drug that is used as a pain reliever. When used as prescribed and for a short period of time, opioids are considered safe. However, even when used correctly, dependency can still occur. Opioids offer pain relief alongside of a sense of euphoria, which may be one of the reasons for the misuse. The opioid epidemic began in the late 1990s when pharmaceutical companies reassured healthcare providers that the medicine would not lead to dependency. Because of this declaration, opioids were prescribed at a higher rate. Since then, addiction and overdoses have increased exponentially. The opioid crisis is not only a national epidemic, but a worldwide epidemic. It started in the 1990s and has grown exponentially. 3 million U.S. citizens and 16 million individuals worldwide had or are currently suffering from opioid use disorder, according to Azafard et al. 2020. The number of drugs overdose deaths increased by nearly 5% from 2018 to 2019. And it's quadrupled since 1999. Over 70% of the 70,630 deaths in 2019 involved an opioid. So why did I choose the opioid crisis as my final project? The opioid crisis can affect anyone of any race, gender, or economic class. It doesn't matter who you are, who you know, or where you come from. It can affect you. So in this picture, you can see I have my two little brothers are there. We adopted them when I was a little bit older, and so I've kind of always taken them under my wing, and I definitely don't want them to fall to be part of the statistic of the opioid crisis. So they were my motivation for this project. So Now that I have spoken a little bit about my public issue, I would now like to switch to my reflections that I have gained from my time at Nebraska Methodist. I'll start with effective communicators, then lead into my reflective individual, and follow up with my change agent reflections. For my effective communicator reflection 1, in my first experience was during my first rotation in clinical. I spent a little extra time talking to a very nervous patient to explain what to expect during this exam. He had just been sent over from his primary care office and really had no idea why he was here, what we would be doing, what even an ultrasound was, and was just very stressed out, very nervous, very scared. So I just took my time and explained to him the best of my abilities what to expect during this time with us at this site. During this experience, my learning was that many times patients are just very scared and unsure and just really need reassurance and extra kindness. So I definitely learned that from this experience, just to take extra time with each patient, see each patient as their own individual, and give them that extra kindness, extra information that is needed for that specific person. And this applies to my public issue in the fact that we just need to take extra time to teach the public or loved ones about the risks and dangers of opioid use. A lot of people don't know how serious it is. They haven't been touched maybe by it like so many other people have, and they really just don't understand how serious this issue is. It also applies to prescribers taking their time to address the opioid crisis and realize something isn't working in the healthcare system and needs to be addressed. So that needs to apply to them, taking their time to address the opioid crisis and to prescribe accordingly so that they can help address the opioid crisis. My effective communicator reflection 2 is about an experience I had as a front office receptionist. It was a conversation that I had with a client that was very angry about a medical bill that he had received. It turned from a very heated conversation to a very nice conversation with an appreciative person who was just scared about affording medical bills. I learned from this experience that it takes practice to be an effective communicator. And this was definitely a challenging conversation I had, but I definitely grew from it. So it just shows that having challenging conversation leads to growth, and that is what I learned from this experience. This applies to my public issue because it shows that having those difficult conversations are important and they're warranted. And having those difficult conversations and addressing the need for someone to seek help for their addiction is needed and is warranted. Opening that line of communication to those people and let them know that there's help and that they're not alone in their fight. For my reflection individual 1, I wrote about an experience I had while I was at the Children's Hospital. Initially, I was not very excited about spending a whole week in an area that I did not have interest in. But after that week, I spent a lot of time with the ultrasound technicians and spent a lot of time with pediatric patients. And I definitely had a change of heart. I loved it so much, I asked to go back for a second week. I would have never learned this about myself had I not had this experience. I learned from this experience that you can learn so much from a different demographic than yourself. I had written off pediatrics as something I was not interested in because I had no exposure or experience with children in the ultrasound world. I was used to being around adults, working with adults, and I believed that helping adults would be my true calling. This experience opened my eyes to the vast world of ultrasound and all the opportunities that are available. This applies to my public issue and the fact that we do not have a specific demographic of the face of the epidemic. We rarely think about the epidemic and how it can affect more than just the person that's addicted to the opioids. Nearly 6 million kids under 11 are currently living with a parent who's struggling with addiction. Around 1 in 3 children who live with a parent in this situation will enter foster care due to the risk of the situation. Because of this, it's been important to bring awareness and address the issue of opioid addiction in a way that children can understand. Recently, a scene on Sesame Street was filmed where a character was being babysat while her mother was at a meeting. This is an important demographic to reach because opioid use can expand to children. In 2019, an estimated 10.1 million people aged 12 or over misused opioids in that past year. This is just another obstacle that we need to deal with to bring about change and decrease the number of opioid users, and that definitely includes children. In my reflective individual 2, my experience was when I was working as a veterinary assistant. A woman from out of town had called and needed her sick dog to be seen. She said she was having trouble finding a clinic who would see an unestablished patient towards the end of a workday. I could have been biased and thought she should have been more prepared if she was traveling with a pet, having her papers in order and things like that. But instead, I played appointment Tetris, moved things around, and found a time for her dog to come in and be seen. I learned from this experience to let go of bias, to work with others, and be flexible. I reflected on past times when I had been in a similar predicament. This relates to my public issue of the opioid crisis because opioid addiction also is non-biased. It doesn't care about economic status or race or sex. It doesn't care if you're a 13-year-old who loves to play the piano or a 73-year-old who volunteers at the community garden. Anyone can become addicted to opioids. In my change agent reflection, my experience was when I saw a need for change in our clinic's carbon footprint. So I started a small recycling program which helped pounds of recycling avoid being sent to the landfill. What I learned from this experience is that every little change is part of the bigger picture. What you may see as minuscule may be the starting off point for huge change. The few papers I started recycling eventually blossomed into bins of plastic and cardboard and pounds of paper products being recycled. This relates to my public issue because new programs have been popping up across the country to avoid opioid overdose and addiction. They start off as small projects and bloom into bigger things like webinars and regional events across the country that bring people together to collaborate and find ways to use their expertise and resources to respond to this opioid crisis. This has led to initiating new policy like prescription drug and renewal policy, and providers registering with the prescription drug monitoring programs. In my change agent reflection 2, my experience is when I found common ground with an elderly patient and helped her see how important her health was, not just for herself, but for her family members who loved her. I learned from this experience to be an advocate for the patient and assure each patient that we are there to ensure that they get the health care and help that they need. This applies to my public issue, the opioid crisis, because like how I advocated for my patient and her health, we too need to advocate for people who suffer from addiction and their families. We can and have made strides for advocating by initiating tools for better pain management, treatment, and recovery centers, and grants for communities to combat the opioid crisis. Nebraska has an anticipated an award amount in the $27 million worth of grants to help fight the crisis. In 2017, HHS issued $800 million in grants in support treatment, prevention, and recovery efforts. That's according to Better Treatment 2021. We as a nation have seen the need for assistance, and we are working towards the goal of a better tomorrow. We are a community at Nebraska Methodist. Over the years, we have reflected on experiences, learned through great conversation, and brought about change within ourselves and change with others. As I step out through these doors of Nebraska Methodist, I know I will use the knowledge and skills gained to help the greater community.